That's what Russian invasion brought to Ukraine. One of the 750 hospitals completely destroyed. War Russia started against Ukraine brought terrible things. We have 15 million populations moved out of their homes. Over 9 million are the war refugees and over 6 million within Ukraine. Economy is going down. It's actually facing collapse because even optimistic forecasts expect 30% decline in GDP. Moreover, about 50% of the businesses have closed their operations, leading to huge level of unemployment. We are facing terrible risk of poverty. According to UNDP, 9 out of 10 Ukrainians will face poverty this year. In regard to health, we managed to maintain the response, especially for key and vulnerable populations. It dropped initially, but then we managed to get on track, maintaining services for more than 200,000 key populations. We face experience of innovations with ARVs, antiretroviral treatment provided to 3 to 6 months, with opioid substitution therapy medicines provided for a month, which is very unique, but this is done in response to the war situation. We face demand for new services in new locations. In Western Ukraine, where I am located, increase in services was so huge, like 5-6 times. For some services, like overdose prevention with naloxone, we're also facing increase in demand. So it's getting, I'm sharing these examples to show how dynamic the response should be. This chart shows drop in testing, and then slowly we are getting back on track, as well as with the treatment cascade. This is an example of PrEP. In Lviv, Western Ukraine, demand in PrEP increased 6 times, even more. This means that we need to deliver 6 times more medicines, ensure that social workers and staff will be available for 6 times more clients. In the time when your population is so mobile, you cannot be statical. So what we did, we modified service provision and shifted it to mobile mode of delivery, outreach, and it faces huge demand, especially in the areas with the destroyed infrastructure. You see examples including delivery of antiretroviral treatment to the areas affected by the war. That was done with PEPFAR support within CDC. Civil society stepped in the situations when even some other governmental partners withdraw. That's happened with the delivery of opioid substitution therapy treatment. The governmental logistic company said, no, we would not go to the areas affected by the war. So it's actually civil society who stepped in. Civil society with their motivation and did delivery to all locations, to all medical facilities, so no patients faced interruption of the treatment. During the time of war, we should be ready to step in new areas of work. Humanitarian aid. We didn't do this before, but now we delivered over 500 tons of humanitarian aid. Over 520,000 kilometers were our drivers in common reached. I would like to share with you several stories. One is about treatment interruption. When the war started, it was so existential crisis, so much threat to life. So Yelena who arrived to Lviv and whom we met, said, I stopped ARV treatment provision. I didn't feel sense to continue with such existential threats. She also was cut off from opioid substitution therapy and started to use street drug again. Overall, during first weeks of war, we lost contacts with over 20,000 people living with HIV who were on treatment. It took an effort to renew these contacts, to increase motivation, and to get people back on treatment. It's a huge work and very complex work. Sometimes done virtually with service like Help Now, with support to patients even located in Western countries like Hungary, Germany, but it's an illusion that advanced health system will solve all the issues because people still feel very excluded with no language knowledge, with no social contacts. Another story I would like to share of Anastasia, who got information about her HIV status 2 weeks before the war. It was shock. Then it was several weeks of contacts and she started ARV. And at the time of things started to normalize, war started. It was another shock, another escape and hiding, moving around. So she said, I don't know what will kill me first, bombs or HIV. And these problems, even with continuation of ARV treatment provision, are not resolved because the biggest threat now is mental health. We all require this, and the same as she said, I cannot sleep. These air raid sirens every day turns me mad. I need professional assistance. And it is actually very important that we have unaddressed needs. I would like to share with you three. One is flexible funding. We need flexible funding to address people's needs. We cannot say no to the request. And if someone asks for food, we cannot give condoms. We need to give food. This is an unaddressed need. Another big thing is mental health, I already mentioned. Everybody likes to mention it, to talk about mental health. But who actually funds this? We need funding for mental health. Finally, we need access to innovation. Cabotegravir, long-acting PrEP, long-acting buprenorphine for substitution therapy, long-acting ARVs. In the time of war, we critically need this, maybe more than any other country. So I'm asking for help from pharmaceutical companies able to share their medicines. And finally, we also have a booth here at the Global Village, and everyone who is ready to help, to express your solidarity, you can do it at Alliance for Public Health booth in the Global Village. Thank you.